Hello everyone, welcome back to Tutor IMG's short medical series. We're going to continue our discussion about antipsychotic side effects, and we're taking a look at a very important one, which is basically tardive dyskinesia. Now, when we talk about tardive dyskinesia, the term is actually an umbrella term, and it includes a number of movement disorders, which are basically tardive dystonias, right? Tardive akathisias, and of course our tardive tics, tremors, etc. Now, why do I make a distinction here of tardive dystonia and tardive akathisia? Because the same things can be seen in acute form as well. And the interesting thing with the acute form is that, and we'll discuss that in just a moment as well, or maybe in a separate video, that the acute forms of these conditions can be treated and are easily reversible because they develop after a short exposure to the antipsychotic, and removal of the antipsychotic or reducing the dose will see an improvement in symptoms. The problem with tardive, as the name suggests, is that it develops after about 3 to 6 months of drug exposure. And when it develops, it's hard to treat because what's happened now is that new pathways have been forced in the brain, and these symptoms are then difficult to reverse. So tardive dyskinesias, remember, are basically abnormally or impaired voluntary movements, and they are more or less irreversible. They're seen equally with first and second generation antipsychotic drugs. And the main action is, of course, the dopamine blockade, right? Dopamine receptor blockade. Another drug, just for general information, that can cause this is metoclopramide. Now, which patients are at an increased risk of developing these tardive dyskinesias? The risk is increased in patients who are older, usually over 55 years of age, female gender, right? Those who have been using the medication for longer, those who have schizophrenia, right, as an underlying disorder for which this medication is being used, those who have an underlying mood disorder, and those who have comorbidities like diabetes, or, as we always know, substance abuse issues. Another interesting thing to watch out for as a risk factor for development of tardive dyskinesia is the patient's history of getting ECT, electroconvulsive therapy. Okay, so if the patient develops these particular side effects, like I said, it will happen a little after 3 to 6 months of drug exposure. So what should a doctor do since it's irreversible? You need to have a high level of suspicion for the development of this condition, and you should be screening the patient very, very carefully. What method do we use for screening a patient? It's basically a checklist, a form of which we basically call abnormal involuntary movement scale, right? And this scale is used to assess patients who have been placed on antipsychotics. So usually a patient is seen every month after you start a medication. And at every visit, the scale is used to assess a patient's level of abnormal movements. Please remember, if the patient develops abnormal movements, it's not always tardive dyskinesia. It can also be other movement disorders, right? Like, say, Huntington's chorea, Wilson's disease, and so forth. So how do you suspect that? You suspect that when the patient develops motor dysfunction, focal neurological motor dysfunctions outside of the spectrum that we're discussing. Okay, so muscle weakness, ataxia, and weakness, focal weakness. These are going to be things that will steer you away from the diagnosis of tardive dyskinesia. So what is the treatment for patients who develop tardive dyskinesia? Stop the drug, right? That is a must. First thing you must do, stop the drug. What do you do next? Now, because these are patients, of course, who are being given the drug because of a condition, you cannot just stop the drug and leave them be. So the other thing that you can do for them is to start them on clozapine or olanzapine. Both of these drugs seem to have a good impact on resolving tardive dyskinesia symptoms, right? Clozapine, of course, has the best treatment profile. I hope this helps you on the boards, and for more such videos, please keep supporting our channel. Thank you very much.